So, Cathy Smith, thank you so much for being here. And Really interested in hearing about your experience developing standards of practice for the patient simulation field, specifically the human patient simulation folks, the people that have been called standardized patients. Um, the language keeps changing. What is the current term for standardized patients these days? This is how standards change, by the way, I think, over the course of time. What is it now?
Well, the term that I use and many of my colleagues use is simulated participant. And
Simulated.
that is indicative of the expanding scope of practice of SPs. So at one point, SPs were known as standardized patients because they primarily portrayed patients, but they can portray any human being in any role. And typically, like in healthcare, they may portray a patient or a family member or even another health professional. I consider any simulated role player who is not the learner to be an SP. And I think, starting with terminology is so important, Tony, because everybody then has the same shared mental model. Because as you know, SPs are sometimes referred to as actors or standardized actors or standardized patients. And the issue with calling SPs standardized patients, which came from, I think, high stakes exams. So there was a reason for it. And I used to call SPs standardized patients. I've evolved my understanding and my use of that term.
Yeah, this change of terminology really does reflect, I would suppose, a change of standards of practice.
Yeah.
And you mentioned the terminology, which is so important. Sometimes we use the same word that means different things. If I could take you back to how the standards of practice were developed through the Association for Standardized Patient Educators, or ASPE. Can you tell me a little bit about your experience and your observations in that process? Who was involved? How did it start? All that.
So Gail Gleason McConvey was really the person who really got this started. It had been talked about for a long time, and she convened a working group because there were no standards. So they talked about what they thought should be in the standards, and they created a document, a working document, a talking point document that then got circulated through 4 or 5 groups of SP educators. And we tried to bring in people from other countries. So this was done before the days of Zoom. So when we were at face to face meetings, like at the conference, for example, so there were focus groups, perhaps you could say, who provided input. And then we got to a place where they did what's called a modified Delphi process. So a Delphi process is where you invite a group of experts to come in and to say what they think is important. And it can be done in different ways. The reason why we called it modified is because in its purest form, there's nothing on the paper. And people go, well, I think we should have like a training domain. And I think this should be in it. But we gave people the content and we said, do you think this is appropriate? And if not, what would you suggest? Or is there anything else that should be there? And we went through 3 rounds. And each time you go through the rounds with the same group of people, you're uh, you're working towards getting consensus that the largest number of people agree, yes, this should be here. And if people say no, they don't think this is important, then it's removed. And so at that point, this was about, I'd say, a year and a half before the document got finally completed. It was still in a very rough form. And so a group of us, and they're all the final authors on the paper, we came together as a working group. And we were the authors, the final authors representing all the people that had been working on this, and they were identified in the standards of practice document. And we really just bashed through it, clarified the language, clarified how we organized it, because that was challenging because we were starting from a blank page. So we really and it was interesting when we looked at um, different models. Uh, it, it there isn't one model for our standards. So we really had our freedom as long as we were clear about what we were doing. And then eventually we submitted it to Advances in Simulation, and there was a peer review. And then from there, so we modified the document based on that peer review as well. And
Yeah, I'm curious about that initial work group that Gail Levis set up. How did that group come about? Do you know
I
exactly when
don't
that started?
really, yeah, I don't have a lot of, it might be something to talk to her about, but I wasn't involved. This was like about 5 years before the standards were actually published. But I'm not quite sure how how that decision was made and how the decision was made to have people in that group. But I know there were people that represent various scopes of practice, but they were from North America because again, at that time, it was 2013. It seems like the world before Zoom, but just, online platforms were just starting to happen, right? So conferencing platforms. So I think it would look very different if we were doing it today because we have so much more flexibility.
Yeah, I can imagine that the work groups would encompass so many more constituents.
Yeah. I don't know if you want me to talk about this now or not, but just the importance of why we needed them. Would
Yeah,
that be helpful?
yeah, I'd love to hear that. Yeah, why
Yeah.
why did we need them at that time? Yeah.
So at that time, if you'll recall, Anaxel was starting to develop their standards
Hmm.
and um, and other groups, and really as a mark of professionalization, because our area is human role players, we are probably best placed to create those standards, but that entails a responsibility of stepping into those shoes. And there was a whole recognition, like, in the early 2010s, like starting forward. And again, I can't speak to this with historical accuracy, but certification at SSH, like and other organizations like SESM and ASPE in the UK, and many others across the world. Those are the ones that I'm most familiar with. But we've been doing this work, like in the case of SP work, it started in the 60s without any guidance. And I know I started out in this field as an SP, and I started out in the late 80s as an SP. And I would get sent in, in my background, I have a PhD in drama. I taught at university level, and I'm also a working actor, or I have been. I'm a working actor in my soul, but I've been a working actor. I work full time now in health simulation based education. Um, but at that time, uh, I would be asked to go and I'd be portraying somebody who had a sore knee, and the tutor would go, "Could you do like a Breaking Bad news case where a woman's just gotten this horrible diagnosis that she's going to die in 2 months? I think the students would really like that." And the actor in me would go, "Yeah, this is great." But the problem is that I wasn't briefed on this, but the learners weren't, and it wasn't the learning objective of the session. Equivalencies of that would be when mannequins died. Let's make the mannequins die and see what the students do. And this caused a lot of like trauma for people potentially, or just go in there as an SP and just use your own history. Just do whatever you want there. Just sense it out. And but there was no guidance, there was no debriefing, there was very little briefing, especially if you were deemed to be competent. And this is not in any way casting aspersions on anybody who hired me. This is the way it was with all of us and in all aspects of simulation. And there was a recognition we can't keep going on like this. And also for the educators to justify to the administrators why there needed to be a budget line for training, why there needed to be a budget line for briefing everybody and creating this material, because that takes a lot of time. Once you've got it created, then it's there for you, but you've got to conceptualize it when you're creating a new simulation. Why there needed to be time for debriefing of the SPs and the SP educators. Why there needed to be resources putting into training SP educators, just as we train simulation facilitators, for example. So this guidance was really important
Mhm.
to kind of create a shared mental model so that everyone in this simulation circle understands what the scope of practice is for an SP educator, and also for the safety of SPs, because there's both physical and psychological risk to SPs. So the standards really were helping everybody to understand what it is that we do to define it, and how do we do it in a safe way and in a way where we can achieve the learning objectives, because it's also about accountability.
Definitely is a need for standards. So the question comes up, who gets the right to develop the standards? Who should be included in, let's say, the narrative medicine conversation?
Wow. So my opinion is, excuse me, that you need to get as broad a perspective as you can from as many stakeholders as you can, because the standards are designed to be flexible, and they're not rules, but they're guidelines. We try to appeal to, because we're dealing with a diversity of practices all over the world and cultural differences. Excuse me. So, my sense is that it's really important to cast the net wide. And but this time we are actually revising the standards, and I'm on the committee. And I also just want to stress that these are my opinions. I'm not representing ASPE here at all. But I'm on the committee that's rewriting them. And we invited the whole ASPE membership. Anybody, an email went out to all 900 members, and anybody who wanted to be involved could be involved. And we ended up with almost 50 people who went through each modified Delphi process. So I actually, we did what we did, we put a cap on it that people have to have 5 years experience. However, this person's 5 year experience could be different from this person's 5 year experience. The other thing that's really interesting, Tony, is that I've been involved in an initiative with SSH, which is the Society for Simulation in Healthcare, and NAXL, which is the Nursing Clinical Simulation Organization, and ASPE. And this has been going on now for about 5 years, where we do a 4 week series. It's an hour each week, and we talk about standards and certification and accreditation. And then each week we talk about, each organization presents. And we get a number of people who are they've been maybe simulation educators for 5 years, and they're so frazzled because now they have to work with SPs and they don't know what they're supposed to do. And, so there's a lot of people like that. And we have had no problem filling 4 to 6 cohorts a year with people. And some of them are experienced people, but didn't even realize the standards existed, or saw them but didn't know how to use them, or didn't have time to do it. And, so kudos to them for taking the time for this professional development. But I think it's important to get diverse perspectives, and also to get perspectives from outside one country. And even the difference between Canada, where I'm from, and the United States, it's on this, to people from outside North America, they think it's the same country, and it's not. There's many similarities, and there are differences as well. So, and they're not like, it's not good or bad. It's just, it's important, like, to get those diverse perspectives.
Yeah, and you mentioned that in revising the standards, you at least asked that people had 5 years experience.
Yeah.
without perhaps looking at their credentials, for example, how many courses you took, what your degree
Yes,
was.
no,
So yeah, it's just, people who are practicing in the field for at least 5 years, regardless
yes,
of their skill
yeah,
experience.
yeah.
You mentioned something interesting. When years ago, I was doing a talk on SP work. I can't remember where it was. It was in Europe somewhere, Sweden. Somebody came up to me afterwards and said, you Americans, and he was really thinking, I guess, of North Americans, but I was American. He said, you guys think that this is a science and that you can assess skills. He said, but in Europe, we really think of this as an art. And it really, he kind of dismissed this whole idea that you could standardize people, you could run a standardized exam. It really did show that there were lots of different ideas about how to train the use of simulations, all
Yes.
that. And I think it's still persists even in the field,
Yeah.
because narrative medicine, I think, like SP work, is still in a period of proliferation. It's still growing. SP work is much
Yeah.
larger. One question I had though about standards, and this has been like my kind of split mind about it. I think they're important, but I also wonder, do the standards um, indicate that a field is firmly in middle age? It's past the growing stages. Uh, doesn't do the setting of standards inhibit innovation, or do they provide a framework for moving forward in a more sensible, uh, in a more sensible way than just haphazard? Any thoughts about whether standards really stop growth?
Yeah. So I think if the standards are rules, you must do this. I think that would be inhibiting. I really think it's much more the second option that you offered, that what I've seen from the implementation of the standards is, first of all, a lot of stakeholders that we work with who are regulated and have standards, there was like this relief that, okay, now we understand what you're doing. There was a clarity. There are, in the current standards, we found gaps, and that's why we're iterating it. Um, and there are topics that people are bringing up. For example, working online, which proliferated with COVID and continues, working with specific populations of SPs. I'll just say older adults in my, like, should those be in the standards? And we're grappling with that now. How do we point people towards emerging understandings of our practice and keep the standards open enough so they're flexible to various contexts? And as I said, we're literally trying to figure that out right now. So I think it's really this juggling act. It's also, Tony, to go back to something that you said. For many years, when I go to SP conferences, I was really puzzled when I first started out at going. SP started, so it's still very young. It started in 2001, not very long at all. And I think these standards were maybe in our teenage years, but because we kind of staked a claim, but it's really emerging professionalization. And sometimes teenagers don't want to turn into adults. And I think it's a way of pushing people past that line into becoming an adult, because there's a responsibility.
You also mentioned, I think, the five domains of SP
Yeah.
work. Uh,
Yeah.
How did I'm just curious, how were those domains developed? Was it through this Delphi process, as you're saying, continuous conversation with experts, whether or not they were truly experts? To me, it sounded like an expert was somebody that has simply been in the field for a number of years.
Well, it was iteratively done. So over the course of 5 years, really, through these various levels. So when it came to this final working group of authors, it had been, I think it was roughly organized. The one domain that was not really there was professional development, which is the fifth domain. So the five domains are safe work practices, um, case development, and we're going to modify that to call it scenario development to reflect how language changes in simulation and in the world. Um, Training SPs for feedback or for role portrayal feedback and assessment, program management, and professional development. And professional development wasn't there. And a colleague specifically from Germany really pushed to include it because so she could get funding to come to conferences. Not just her, I think all of us, like she really brought to the forefront how important it was because who is going to look at this document? Deans, administrators who budget or fund programs. So it was really looking about this is a document for SP educators to guide them in helping to support SPs to do the work that they do. Let me just take training for role portrayal. The principle is preparation, executing the training, post training. And that took us a bit of time to get to. And then within those principles, what are the practices which are not specific how to do it, but kind of broader actions that you can take.
Hmm.
So it really took a bit of time for us to figure this out, and also what made sense to us as a group. And we went back and forth many times. It was like a year and a half process. Um, and kind of, everybody's perspective was was accepted. And one thing, for example, that I really fought for was making sure there was a budget for debriefing SPs. And some people went, why would you do that? And because that wasn't their context. But now you go to conferences, that's common practice. And that's what a lot of people say. Thank goodness this was the one thing that made such a difference. Or debriefing the SP educators, right? Like, thank you for doing that. That really helped us to mitigate burnout.
Yeah. Yeah, these extra steps um, hit the bottom line, you
Yeah.
know, and so therefore, if it's a standard, you can then refer to the standard as something important and make your argument based on the accepted standards of this field. Cathy, it's really been a pleasure talking with you about your experience. I'd love to come back and talk with you again at some point as we struggle to develop our own standards in this emerging field of narrative medicine.
Yeah.
So,
Well, I'll be very interested to see how that goes forward.